Hi everyone and welcome back to my channel. My name's Sophie and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today I just wanted to sort of talk about my thoughts about sort of where I would be if I didn't work in the medical field. And with that I mean I've used my position in the medical field, which again, I'm not a doctor, not medical advice, all of those good things. But had I not been working in the medical field and have a sort of background knowledge in medicine and how the body works and everything, I really do think I would have just been dismissed. And this is a problem for a lot of reasons. So, just a few of my experiences where I've sort of used my medical knowledge to sort of come back at doctors goes all the way back to 2020. When this all started, I was having bouts of pneumonia. My pulmonary function tests were really bad, and they were giving me this medication, which is basically used for like COPD, which, as COPD implies, is an obstructive lung disease. And my pulmonary function test did not show that I had obstruction. So I was continually asking them, why are you giving me this when my pulmonary function tests do not show obstruction? And they would just sort of look at me, sort of surprised that I was saying anything, and just told me to try, which I did, and it didn't work because I didn't have obstruction. Also, 2020, the famous provider telling me that maybe the problem was the small airways in my neck that aren't visualized on CT scan. And I looked at her and I said, there are no small airways in your neck. And she looked really surprised. I don't know why, but she did. Again, on all of the intake forms, you put your occupation, so I don't know why doctors keep trying to like pull stuff like this. It's really disturbing to me. Because what if you don't have that knowledge? What if you just take the doctor's word for it? Like, where would I be if the past 3.5 years weren't spent continually arguing with doctors and being like, no, that's not how the body works. Like, I work in this area. Like, why are you trying to do this? And it terrifies me, to be quite honest. Like, just sort of what are doctors getting away with because people don't know better? And it's just really scary to think about. With my latest, not even issue, because it did kind of get something done about it, but with the heart failure, and the doctor originally saying everything looked pretty normal, and I had to come back with, you're okay with the pressures being elevated? Oh, well, they're a little high. No, they're diagnostic of heart failure due to the XYZ paper. And this isn't special knowledge that I somehow got in the school I went to. This isn't because I work in the medical field. It's because of Google. Like, no one knows everything about the human body. I know when I have friends or when I read stories online about people getting accused of playing like Dr. Google. Doctors have a Google they use also. The website is called UpToDate. It is very expensive. I would love to have a subscription to it, but I don't have that kind of money. It's like $600 a year or something like that. But that is where doctors go when they need to learn about stuff. They go to UpToDate. So I don't understand this sort of jab at patients when they come in having done research on Dr. Google, because doctors themselves, if they need to learn about something, will go to Google or UpToDate, or they'll read articles in journals, which a lot of people can access through Google. The internet has really kind of opened up the medical world to everyone, and I think that's wonderful, because doctors aren't perfect. They're human, they make mistakes, they do not like to be challenged, and they don't like when they don't know something. And unfortunately, us as patients get the short end of the stick because they just don't believe us. They accuse us of, oh, like you need to stay off of Dr. Google. You've been reading the internet too much. Which, yes, definitely can happen. I'm not dismissing that. I'm not saying everyone who goes in having researched something is right or anything like that. All I'm saying is doctors dismissing patients because the patient comes in having done research is just wrong. Because the patient is the expert on their body. The patient knows what is normal for them and what is not normal for them. The doctor is just sort of a tool the patient is attempting to use to help get answers. And it really, really makes me stop and think, like, where would I be? What would have happened had I not had a medical background? Anyone could have Googled, anyone could have gotten the results of the right heart cath that I got, looked them up on Google, found this heart failure paper that outlines like the wording they use and the diagnostic criteria and the medications that are used. They could have gone to the appointment, they could have said the exact same thing I did, minus the part where I say, I'm a blank, I don't know why doctors keep trying to pull stuff like this with me, but I almost believe most doctors would have just told them to stay off Dr. Google. And that disturbs me to no end. Like, I cannot put in words how much that bothers me. All of that to say, if you were one of the people who go to Google to try to figure out what's going on with you and the doctors aren't being helpful, don't stop. Like, keep advocating for yourself. I know it's hard. I know it's defeating and it makes you like question your self-worth at times and it's just hard. But sometimes it just takes a long time to find the right doctor, to find a doctor who's willing to admit they don't know, who's willing to listen to someone who, for whatever reason, they deem as their inferior. But you're the expert on your body. Keep trying, keep pushing, keep advocating, and I hope we all find a doctor, at least one, who will take us seriously. That's going to be it for this video. I hope you guys are having a good day whenever it is you're seeing this, and I will talk to you guys next time. Bye, guys.